Welcome to the Deep Dive. Today we're taking a closer look, a deep dive actually, into a very common test. The full blood count, or FBC. It sounds simple, but it gives massive clues about your health. Our information today comes from a really helpful guide by Blood Test UK.
That's right, and our goal here is, well, it's to make the FBC clear, to talk about its huge benefits and, importantly, how people can actually access it, say, in places like Workington. We want to keep the language simple and clear.
Okay, let's start with the basics then. Can you break down what an FBC actually is in simple terms?
Sure. A full blood count is essentially a quick snapshot of your blood. It mainly looks at four key things. Think of them like tiny workers inside your body. First, you've got your red blood cells. Their job is to carry oxygen, basically the air you breathe, all around your body.
Okay, the oxygen carriers. Got it.
Then there are the white blood cells. These are like your body's security guards. They fight off infections, germs, that sort of thing.
Right, the protectors.
Third, platelets. These are tiny little helpers. If you get a cut, they rush to the scene to help clot your blood and stop the bleeding.
The little first responders.
Exactly. And finally, there's hemoglobin. This is actually the specific part inside the red blood cells that grabs onto the oxygen.
Ah, okay. So the test checks if all these different workers are present and presumably in the right numbers.
Precisely. Knowing if you have, say, too few red blood cells, which could mean anemia, or maybe too many white cells pointing towards an infection, well, that's incredibly useful information.
Which leads us straight into the benefits, right? Why is getting this test regularly so important?
The biggest benefit: early detection. Honestly, getting tested regularly is like having an early warning system for your health. Finding a potential problem early, when it might not even have symptoms yet, usually makes it much, much easier to manage or treat.
That makes sense. And it's not just for finding new problems, is it? It's also about monitoring things people already live with.
Absolutely. It's incredibly valuable for people managing long-term conditions, things like diabetes or heart issues. And it's crucial for patients undergoing treatments like chemotherapy. Doctors, for example, the local doctors in Workington that Blood Test UK mentions, they rely heavily on FBCs. They use them constantly to check if treatments are working as expected, and just as importantly, to make sure they're safe for the patient.
Can you give an example of that, how it helps locally in Workington?
Yeah, Blood Test UK points out a couple of key uses there. For instance, monitoring pregnant women. FBCs help check for anemia during pregnancy, which is quite common, and as I mentioned, cancer treatment. Chemotherapy can sometimes lower white blood cell counts drastically, a condition called neutropenia. Regular FBCs are vital to catch that risk early before a simple infection becomes really serious.
Okay, so it's clearly a vital test. If someone in Workington, or anywhere really, wants to get an FBC, where do they go?
Well, in Workington, residents have a few options. There's the local GP surgery, of course. Then there are private clinics that offer the service. And naturally, the West Cumbria Hospital provides these tests too. Choosing a reliable provider is key for accurate results.
And is there anything special people need to do to prepare for the test? Blood Test UK probably covers this.
Yes, and is quite straightforward. Three main things, really. First, drink plenty of water beforehand. Staying hydrated actually makes it easier to draw the blood because your veins are, well, plumper.
Easier for the phlebotomist, easier for you. Makes sense. What else?
Second, always tell the person taking the blood sample about any medicines or even vitamins and supplements you're taking. Some things can affect the results, so they need the full picture.
Good point. Anything else?
Just a practical one. Wear clothes with sleeves you can easily roll up. Makes accessing your arm simple and quick.
Right. And the results? How long does that usually take?
Typically, results from a GP or hospital are back within a few days. Some private clinics, as Blood Test UK notes, might offer a faster turnaround, maybe even 24 hours. But the crucial thing always is to discuss those results with your doctor to understand what they mean for you. So to kind of wrap up the key takeaway here, the FBC isn't just another test. It's really foundational for being proactive about your health. It gives you timely, valuable insight into how your body's actually functioning day to day.
And thinking about that bigger picture you mentioned earlier, Blood Test UK's guide brings up how FBC data can influence local health policy. So here's something to think about. If regular testing in Workington consistently showed, say, higher rates of anemia in certain groups, what specific local actions, maybe nutritional programs, could the health authorities there potentially implement to tackle that specific community need? It really shows how these simple tests can drive change, from individual health right up to community well-being.